come in here and lift it, and then we'll have him retest his shoulder.
Wow.
Going. Got it. Wow. Got it. Wow. So I immediately hit a block spot, but I went around it. You'll just take a big breath and go. There it goes through. That broke through. You have tissues right there.
Wow.
What happened on that one?
I actually felt that one move.
You felt the whole thing? We have Rayson here today. First of all, what do you want to work on? You know, like back, low back?
For sure I had a torn labrum, so I know for sure my shoulder movement is just completely trashed. Also have like severe like left knee pain.
Okay.
And also I usually have like kind of like naturally cracky wrists. I don't know if you can also look at that.
Naturally cracky is not necessarily bad. Like I have one wrist that cracks a lot, and then this side never cracks. So that's not really a problem, and we usually just get obsessed with that. So different people have cracky spots. When it becomes a problem is when you lose function. Let's say you're not able to lift weights anymore, you're not able to pick up your child with that hand, or you're not able to open a jar. So in that way it's less than optimal function, or if it's in chronic pain, now we need to work on it. But if it's just cracky by itself but normal otherwise, it's usually something that's just being human. Us humans have little idiosyncrasies that we live with, that we accumulate throughout our lifetime, and that's not the big deal. The big deal is when it's pain, function, dysfunction, or symptom issues. So do you think yours is more like weak, painful, symptom issues, or just weird cracky?
I would just say probably just a week.
Okay.
For sure.
So we'll look at it. We'll look at it for sure. And it could also come from the elbow, so I'll look at his elbow and his wrist together. And it could be shoulder, elbow, wrist, so it could be the whole kinetic chain of the arm. I'll look at the whole kinetic chain. The left knee, do you feel it like when you bend down? Here, you can hold on to the table if you want to bend down. Does that give you pain?
Usually just give me like weakness, I would say.
Okay. Did you ever injure it formally, like where you tore something, meniscus?
I know my kneecap popped up once, but it's slid back down.
Okay. And what do you do to your shoulder?
I was playing basketball and someone just hooked onto my arm and he fell down and he just grabbed it.
How many years ago was that?
I would say probably about like 6 years ago.
Okay, is it unstable? Does it dislocate easy? Or?
Oh, well, I had surgery for it about 2 years ago, and it's just like you can tell like the range of motion is iffy.
Where was the surgery?
They did 3 incisions, 2 in the front and then 1 in the back.
And do you remember what they did? What type of work did they do?
It's just they repaired the meniscus, not the meniscus, the labrum.
It was a labrum chair. Okay, yeah. So bring your arm all the way up on that side and face the camera. So you have good range of motion. Look, your arm even goes behind his ear. Do the other side, and it's not as good as the other side.
Yeah.
It used to be very flexible, right?
I was very flexible.
Did you ever do sports like gymnastics or anything like that?
Just like basketball, football, yeah.
So as flexible as I thought the right side was, I see compared to the left, it's not as good. So turn sideways, and this one comes back much further. Do you see that? And this one hits a wall eventually. So you can put your arms down. Was there any pain bringing your arms up?
No, not at all.
How about sideways? So just bring it up sideways. Any pain or any spots you can point to?
It's usually just like real tightness, like probably on around my shoulder blade.
All right, drop your arm. So did you feel at that time going up? So you bring your arm up and it feels like it hurts at a certain point.
Yeah, like
do that now.
I don't know if you can like feel it. You feel like a little bone clicking, like usually sometimes.
Okay, but just do it and then say right here is where I feel it.
Probably say like right here.
Okay, but which part of the range of motion do you feel it? So when you get up to here, now I start to feel it. That's the question. So do one question at a time.
All right.
So do that question first.
Probably say like right where it's fully extended.
So then remember that spot, okay?
All right.
I'm gonna hold this bone up by your occiput, okay?
All right.
Now bring your arm up, see if it goes up further without catching.
It does a bit, yeah.
It comes up easier, right?
Yep.
So turn this way and do that again. So I'm gonna hold the atlas and occiput junction. Is your arm more free now? Try it.
Yeah, feels much more
right?
Smoother.
Good, so lie on your back. I'm gonna do a supine occiput lift. So you could do seated, but I don't really want to do supine because of the angle of this. So I'm going to come in here and lift it, and then we'll have him retest his shoulder.
Wow.
Got it. That was massive, right?
It was.
So come stand up. How'd that feel?
Relieving.
What?
Very relieving.
Relieving, good.
Yeah.
So turn towards the camera and lift the arm and see if it gets higher up before you catch it.
Oh yeah. Way more higher.
So there's a lot of connection between the neck and the shoulder. And by releasing the neck, we are already working on the shoulder. We need to work on the shoulder to work on the shoulder, but we need to work on the neck to work on the shoulder. I know that's confusing. You might want to play it back, and if you hit the backspace on YouTube, it goes back 5 seconds. A lot of people don't know that. So go ahead and lie face up. You know, I have a new animal channel. I don't know, are you aware of that?
Yeah.
Okay, it's called Animal Cracker. I started it just January 1st, 2021, so it's August here at this time. I don't know when you're going to be watching this video, but so that was 8 months ago. We're already up to about 50,000 subscribers and getting like 1.5 million views a month. It's really a cool channel. I have horses, dogs, chickens, cows, rabbits, pigs, sheep, all different animals that I adjust. And the more I work on animals, the more I see how much that neck is connected to the rest of the body. So I can work on a dog's upper neck and it walks better in its rear end with its back legs. I can work on a horse's neck and its shoulder heals, or its shoulder improves function because I'm finding something up at the pole, and then the limbs work better. So in your case, you had an upper cervical, or in a horse that would be the pole, which is that top part of the neck on a horse where the top bone meets the skull. And often on horses, I work on that spot and the front leg starts working better if it had front leg or front limb lameness or problem. So just by working on that, learning from horses, I applied it to you and it worked on you pretty well today. So scoot down this way. If you haven't checked it out, check out that channel because it's really interesting, because it's not as dramatic. You won't hear as loud cracks as you do in humans, but you'll see how there is just a methodology of working on animals, and it does relate back to humans. Scoot this way. I feel like it's making me more tune into humans. I don't want to say it's making me a better chiropractor. I'm always trying to do the best I can, but it's making me tune in more, because an animal can't tell you, oh, my back leg hurts. I have to just find it, and I find it by feeling the muscles. I look at the hair, I look at the ears, I look at the eyes. I see when I touch a spot on a horse's hip, if its ear moves or its eye twitches or if its eye contracts. So I'm always looking to figure it out by touch rather than oral communication. And even though you can tell me my right arm hurts and I play basketball and somebody jerked my arm, I'm still thinking, what is he really telling me under that? Like, is there muscles that are involved that will explain a story to me? And I felt like there was a muscle that was tight at the base of your skull pinching on a nerve that was explaining a shoulder story to me. So now I'm going to do a shoulder adjustment. Hope everybody didn't mind that long explanation, but I think it's appropriate because it fits to what I'm doing right now, which is I'm following his upper cervical, or in a horse we call it a pole, down to the shoulder. Then I'm going to work on his shoulder, his elbow, and his wrist, because that whole kinetic chain was out. And instead of me just stopping at the wrist or starting at the wrist, I'm doing wrist, elbow, shoulder, and going up even higher where I think it all starts, which is at the neck. Coming in here, trapping the elbow, pulling this down. Everybody watch this. Big breath in and blow it out. There it goes. So I got the collarbone. Now I'm going to turn his elbow in like this. Ooh, and snap the elbow. Now I'm going to do the wrist. Pop. Pop. Thumb. Good. Come stand and see how you feel now. Go back to your original spot. And move your shoulder down.
Whoa. That's insane.
So it's pretty cool, right?
Yeah.
Now you probably need work. Like, if you were coming in as a regular client, I would probably want to see you in a week. You should also do some strengthening stuff with TheraBands, these type of band stuff. I don't have any in this room. But, where you're doing the band work, you're doing, working those shoulders, rehabbing them. There's a lot of stuff you could do, and definitely stretching. But in the meantime, I got it to clear out pretty good.
Yeah, definitely.
So now you're going to lie on your back. We're going to do a little bit more. We're going to do the Y strap next. We're going to adjust your full body, and then we're going to do a cranial facial release on you, which is the nose adjustment.
Awesome.
From the inside. It's the facial bones being expanded or released from the inside. You up for it?
Sure.
Okay. Is this a good experience or a crazy experience? Or a little of both?
It's a great experience.
Okay, good. So you've been watching the YouTube channel for a while, right?
Yeah, I'll say about like maybe a year.
Okay. So you've seen a lot of videos.
Definitely.
All right, so we're gonna just start to stretch and take a big breath in and then blow it out.
Wow.
How was that?
Intense.
Where did you feel it?
I want to say like around my like skull, lower skull area.
Okay, more. So
Yeah.
you had more in there. I think that got traumatized in the basketball somehow. Maybe you got bumped and it whipped your neck like a mini whiplash. Like a whiplash doesn't only happen in a car. A whiplash is an acceleration deceleration injury. So let's say you're under the basket waiting for the rebound to bounce, and then you're ready to time your jump, and someone bumps into you, your head will snap back. So your body is stationary, and then it whips. And that trauma in the neck can cause problems all the way down through your body. When the neck is torqued, there's a sheath on the spinal cord called the dura, and that can get twisted up and affect all the way down the body. So we haven't got this side yet, so we're gonna do it, okay?
Right.
It's already, did you just hear it pop
Yeah.
already? Wow, got it.
Wow.
Big one, right?
You're very.
So I'm gonna keep going, there's a lot to do. You're like full of spots. So I'm gonna reach under. How many was that?
I was like 3.
Yeah, and there's more. Good, now you're gonna lie on your side facing me. And turn all the way this way. It's already going. Got it. Wow. Whew. Come to the other side. Got it.
Wow.
Lie on your back. You said it's the left knee, right?
Yeah.
Any pain up in here?
It's just really tender usually.
Okay. Switch sides, Roger. Okay. Keep on the knee. Keep on the knee. All right, so I'm down here with the activator, which is a tapping instrument. If people want to look this up, it's called activator.com. And here's the word activator. Okay, it's a adjusting instrument. I bought my first one. It was a different model. This is model 5. The first one I got wasn't electronic. It was just a handheld one. And I got that 23 years ago. They started making them about 35 years ago, and they're a really good adjusting instrument. You can do a lot with them. There's a whole technique around it, which I've studied, but I'm just using it specifically for his knee right now. And every time I pop it, it moves about there. That just made you jump a little because I hit the patella reflex that time. There, I hit it again, sorry. That probably feels strange. And I'm gonna use the head of the fibula. It's right here. Now the fibula is the stabilizing bone. It ends here at the outside of the ankle, the lateral malleolus. So we don't stand on our fibula. The fibula is a non-weight bearing bone in the body, but it helps. You know, if the fibula is misaligned, the knee is always going to be under stress. And then you also have this IT band that's really tight. Do you feel it?
Definitely.
So next I'm going to do a little bit with this arthro stem. And I'm going to come behind the knee. And that should be a little painful. Then I'm going to come in here and get the insertion of where the IT band comes in. All right, come stand and try it again. Move around. You can bend your knees a little bit, squat a little bit.
Yeah,
A little better, right?
definitely.
So you need a little work. I mean, you're like a project. It was up to me. I would probably have you come in a few times. I would have you even come in next week and we would do another layer. But today we're just doing this video as a first time experience, right? And have you ever been adjusted before?
By 2 different chiropractors.
All right. Was it like this or a little different?
Very different. They just focused on like my neck and my back, and then they just like sent me off.
All right. Well, we're doing a lot today. We did your neck different ways.
Oh yeah.
We did the occiput with that supine occipital lift. I did a big left adjustment. We did the Y strap where you felt some in the neck and back at the same time, right?
Yeah.
The Y strap, how far down did it go?
I want to say between like my shoulder blades area.
Okay, cool. Now we're gonna do the face. What had attracted to you to the cranial facial release?
Well, usually I would like wake myself up because of snoring, and also from basketball, I've been hit in the nose so many times. So
Okay.
hopefully that'll give me some.
Here, tilt your head back. All right, here, do that to the camera. So look straight in, and now tilt your head all the way back. And which is your worst side, the left or the right? And you can test if you want. Keep the head up though. And breathe in.
I would say my left side is my worst side.
Yeah, and you could see the left side is a little squished. So when I look at it, the left side's pulling this way a little bit. And think about it on the inside, not the outside. So the septum, which is cartilaginous, is pulling this way a little bit and blocking or occluding that opening. So breathe in now, and then breathe in. Breathe in, and breathe in. Here, look at me for a second. Breathe in, and breathe in. All right. So, and then let me see your face straight on. And it's kind of bent a little bit too, have you noticed?
Yeah.
All right, so go ahead and lie face up. We're gonna start, okay? You're gonna put your head around this thing. And we're gonna just get this going here. All right. And have this, tilt your head back a little bit. That's good. What would you say is your worst side to breathe through?
For sure, it's my left side.
The left side's more difficult?
Yeah.
Okay, good. So we're actually gonna start on the right today. It's gonna feel uncomfortable. I'm gonna put it back in. And I already hit a block spot. A little more. A little more. I hope I got it back deep enough because it's really difficult on you. Now I'm going to give it a half pump for you to just feel it. There, you feel that, right?
Definitely.
All right, so when you're ready, I'll have you open your mouth, hold your breath, and close and seal your lips. So open it all the way, and then close it. Yeah, I didn't get it in. So that one needs to be redone. Here's some tissues, and you're blocked. Whoop.
Thank you.
Go do your own now. So what happened is he's so blocked up, even on his good side, that it hit the wall. I thought I had it seated down really well. Maybe not well enough. This time it should go in really easy because we already kind of cleared some of it. You probably didn't hear a crack, did you?
No.
Because it just ballooned out. You want to do it again or no?
Sure, yeah.
And we can also not do it again too, so it's up to you.
Go for it.
So stay with him, Roger. Here we go. this time. I know that's uncomfortable. Is it filling up?
Yeah.
Okay, good. So when you're ready, there it went in.
Wowzers.
And I think that even bled just a little bit, so you might take some tissues.
Thank you.
Did you feel it crack through the other side?
Yeah, I felt like a big, like, pop.
It popped. I heard it too.
Oof.
And yours difficult. Mine was difficult like that too, it hurts a little. It's intense. It's uncomfortable. Did you feel pain from it or discomfort, or what did you notice?
It feels like when you're getting tested for COVID. That's what it felt like.
But even more than that, right?
Yeah, definitely.
What did it feel like when it cracked?
I would say, like, it's hard to explain it. Because I never experienced that ever in my life.
Did you like it in a weird way, or do you wish you didn't do it?
I mean, for sure, I can breathe differently.
So try it now. See what your breathing's like now.
Yeah, it's much easier to breathe now on my left nostril or right nostril.
All right, now we're gonna do what's your worst side now, okay?
Oh boy.
So I immediately hit a block spot, but I went around it. Okay. So when you're ready, you'll just take a big breath and go. There it goes through. That broke through. You have tissues right there.
Wow.
What happened on that one?
I actually felt that one move.
You felt the whole face move, right?
Yeah. Wow.
What else can you tell us?
Like my whole front face just cracked, and it's really a different experience compared to everything else.
Keep going. What else did you notice? Did it make a noise? Did you hear, like, what did the sound sound like?
Like, it was like a deep crunch, like I heard from like right in my nose, and I can even feel it's different as well.
It moved. We moved the septum off the middle wall, so your septum was kind of collapsed on that side. And when I was here, look at me for a second. When I was coming through, it stopped, and I was only halfway in. So then I had to make a turn, and I went around it, and then it went all the way through. Then I knew I was ready to do it, and it was hard on you. I did the first pump, it didn't blast through. Then I finally let it refill again, and then I went boom, and it squiggled through and then shot out the back. You could feel it hit the back of your throat. Right?
Yeah, that for
like
sure.
It balloons out the back when it breaks through. It's crazy, right?
It's insane.
And you could hear on the inside, because I've had this done many times to me, where you hear like.
Yeah, that's what I heard on my left side.
And we have 22 different bones in our face. One of the things that the balloon does is it mobilizes the cranial bones. It releases direct pressure on the brain by having your bones squeezed so tight in your face. It relieves the dural meningeal tension, and the dura is like the sac or sheath on top of our brain and spinal cord. So it releases some of the pressure around that. And think of the casing on a hot dog being too tight. And we sometimes feel that way where, like our brain and our skull is just too tight. It definitely opens breathing passageways. It will facilitate sinus drainage, and some of the people that would come for something like this have breathing problems, migraine headaches, sinusitis, tinnitus, which is the sound in your ears, like the whooshing or ringing, vertigo, Bell's palsy, trigeminal neuralgia, sleep apnea, snoring, head trauma, and it helps a whole bunch of different things for people. But we don't really target curing any disease or ailment. So I think that's it for today for you. Wow. I'm gonna have you come sit up and stand one more time where we started. So what do you think overall?
Wow, honestly, that what's it, the nose balloon?
Yes, well, we call it Cranial Facial Release, CFR.
Yeah, that's no joke. Honestly, yeah, I can breathe 100 times better.
Do it now.
No blockage. Wow, it's crazy.
All right. All right. Thank you so much for coming in today.
Thank you, Doc.
All right. Thank you.
Thank you.
Crazy. So we have Rayson back 3 weeks later for a follow-up of the Cranial Facial Release. Let's get a recap. So what would you say your overall percentage change of your breathing is?
For sure, I would say about 70 to 80%. I can breathe much better. I can tell when I sleep, my mouth is not open anymore.
Really?
Yeah.
Okay, so that's just one treatment. Remember, recommended is 3 to 4 treatments. I mean, I shouldn't say 3 to 4. 4 treatments. With someone that has advanced, like, trigeminal neuralgia, face pain, or Bell's palsy, that could be 12, 15, 16, 20 treatments if they've been suffering something for years and years and years that has to do with the nervous system and much more advanced stuff. But for breathing passageways, we're finding 4 can get a lot of the work done. You've done 1, got 60, 70, 80% change already. I also worked on your right shoulder 3 weeks ago. How's that been?
For sure, there's a lot less numbness when I grab onto, like, you know, the train station when you grab on for a while. Like,
yeah.
The tingling is not as severe as it was before.
All right, so we got some changes. In this follow-up appointment today, I'm not going to be able to do a whole session because of the timing of my schedule, but we're going to definitely redo his nose, right and left. I do want to redo that shoulder, so I'm going to have you lie on your back, and I would love to spend more time, but this is my real life. My real life is sometimes we don't have time in the office, and I just wanted to make sure I do the CFR follow-up. So I'm going to come in here and do his right shoulder one more time, and it's, there it goes. You hear a click?
Yeah.
It didn't click on the first one, but then when I bounced through, I got it. So now I'm going to wrap under and do a little bit more thoracics, and that one's fine, and that one's good. That popped. Now, remember, he also had an upper cervical on the right, up at the you know, in the video earlier in this same video, I called it the pole from the horse, which is that top upper cervical. There it goes. It's already popping.
Ooh.
Big one.
Yeah. Wow.
Okay, so that part's done. So now we're gonna do. Here's floppy. Hold on to floppy. Here's a few tissues, if you need them. Everybody needs tissues. Here, go ahead and grab them. Okay. And I'm gonna set this up. And the left side's the worst.
Yeah.
So we're gonna start on the right, and everybody gets to see a follow-up appointment. Oh, let me put this behind your neck so your neck's more comfortable. This arches your neck over and just allows your neck to be supported. And you ready? We're gonna start on the right. Now remember, what you do is you're going to, well, that's me stepping on the foot pedal. I'm going to push it in a little bit so it fills. You're going to open your mouth big, and when you close your lips off, I'll go. There it goes.
Ooh.
Did you hear it crack through?
Yeah, I did.
Did it make cracking noises?
Yeah, I did.
Or just separation noises?
I heard a little crack, 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 crack.
Yeah. Here, wipe your lip off too.
Oops, sorry.
Perfect. What else did you feel? Where did it direct? Like, did you feel it behind your eye and your ears pop? Like, where did you feel it?
I mean, I felt like my whole head, like, just like a little popping sensation, like from my ears, I would say.
Okay. And did you feel any face cracking?
More my nose. I feel it so much on my nose.
Okay, good. That's where we want it. I mean, in your case, that's where you're restricted, right?
Yeah, for sure.
Okay, breathe for a second. What are you noticing now?
It's much easier compared to when I just walked in here.
Okay. And how about here, look at the camera on me for a second. When I have it done to me, I also just feel like my brain is clearer. Does that ever happen to you?
Yeah, for sure. My vision just like zoomed in like to the ceiling.
Really?
Yeah.
All right, that's cool. All right, let's do the other side. What do you think?
I'm ready.
And we're trying to help. I didn't want this just to be a one-off for you where you do one and we go, wow, great adjustment, great crack, but then we don't follow up and see how he really is doing. So I don't know, it might almost be 4 weeks now, right? It's 3.5 weeks, 3 weeks for sure. Because we did it, it was last month, right?
During that hurricane.
Yeah, during the hurricane. Anyway, it's at least 3 weeks, maybe 3.5 weeks. So it's nice to see how you're developing and seeing that you're seeing some changes with breathing and things like that. Okay, so let's do. So now we're going to do the left side. Ready?
Yep.
Wait, I got to be on this side. Went right in.
Woo. Wow.
So you need more tissues, or you good?
I'm good.
There's more if you need them.
Oh, thank you. Woo.
What do you think of that one? Was it different?
That one was much more cracking compared to my right side.
Really?
Yeah.
Here, why don't you sit up for a minute? We'll follow you. Get up, okay?
Prior to the adjustment, I would say, like I said, when I was sleeping, before having my nose adjusted and the CP thing, I would notice that my mouth was open when I was sleeping. I'm like, oh, why is my mouth so dry? And then when I got it adjusted, I noticed that, oh, my mouth is not dry anymore as often as it was before.
Because you don't have to be a mouth breather when you sleep.
Yeah,
right.
So for sure, I could tell I'm not snoring compared to before.
And was the left crack different than the right crack?
I would say the left one was I felt more cracking for sure compared to my right.
Okay, cool. And how do you feel right now, 2 seconds later?
I feel like I'm in a new body. Like I could start a marathon or something.
All right, cool. Thank you so much.
All right, thank you, Doc.
All right. Appreciate it. Thank you. I'm going to come in here and lift it, and then we'll have him retest his shoulder. Going. Got it. Wow. Got it. Wow. So I immediately hit a block spot, but I went around it. Let's just take a big breath and go.